Welcome, everyone, to Safety and Health Week. My name is Anne Tenier, and I'm the President and CEO for the Canadian Centre for Occupational Health and Safety, or as we're better known, CCOHS. If you want to hear the presentation in French or access the American Sign Language interpretation, there is an interpretation option at the bottom of your Zoom window, and we've put the instructions in the chat. The Canadian Centre for Occupational Health and Safety is situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. This land is covered by the Dish with One Spoon Wampum Belt Covenant, an agreement between the Haudenosaunee and Anishinaabe to share and care for the resources around the Great Lakes. We further acknowledge that this land is covered by the Between the Lakes Purchase 1792 between the Crown and the Mississaugas of the Credit First Nation. I am so pleased that we have people joining us from all over Canada today, one of the benefits of virtual events. Last year at this time, we were gently emerging from the rigid lockdowns, physical isolations, and restrictions of the pandemic, and we were testing new norms. A year later, we find ourselves adapting to a changed world of work with hybrid work arrangements at the top of the list. Priorities and expectations have shifted, and workplaces have been challenged to keep pace. Something that has not changed, though, is the fundamental right of workers in Canada to be safe at work. Safe from physical harm, safe from harassment and violence, and safe from bullying and behaviors that affect our mental health and well-being. Our work environments must be safe, and workers must be provided the training and equipment and support they need to work safely. The goal is to protect workers and prevent them from being injured or made ill from their work. And an important piece in achieving that goal is creating a workplace culture in which everyone understands their roles and responsibilities in health and safety, something called the internal responsibility system. A strong internal responsibility system encourages people to report hazardous exposures and situations and watch out for one another. It helps create a robust health and safety culture in which everyone is respected in the workplace. After all, we are better together. This week, all over North America, our attention is focused on workplace health and safety as we celebrate safe work practices and the positive impact a healthy environment can have on all of us. I hope this kickoff event will be a good start to your celebrations. And without further ado, I'm pleased to play a special message from our Minister of Labour, the Honourable Seamus O'Regan, to officially kick off Safety and Health Week.
Hey everyone, thank you all for keeping Canadian workers healthy and safe. That's what Safety and Health Week is all about. Protecting workers' rights, protecting their well-being. You're doing the real work. You're delivering the training and guidance. You're changing workplaces right across the country. Because no one should ever risk their health or their safety for a paycheck. No one should go to work and never come home. Mais ça reste une réalité difficile pour plusieurs citoyens. Juste en 2021, sur 1000 travailleurs, 18 n'avaient que 24 ans, voire moins. Plus de 275 000 ont été blessés. Ça ne devrait pas arriver. Grâce à des gens comme vous, ça arrive de mois en mois. Our workplaces are changing. Our standards, practices, and cultures are improving. Next month, the federal government is raising the minimum age for hazardous work from 17 to 18 in all federally regulated private sector workplaces. Earlier this year, we introduced 10 days of paid sick leave for nearly 1 million federally regulated workers across Canada. That's 1 million workers who no longer have to choose between paying the bills and going to work sick. We're raising the bar for health and safety in the workplace. It used to be just about preventing physical harm. Now we know that's not good enough. And I've said this before, I'll say it again. Your job should be good for you mentally as well as physically and financially. Plus tôt cette année, le Canada a ratifié la Convention 190 de l'Organisation internationale du travail. Elle est conforme à notre loi fédérale sur la prévention du harcèlement et de la violence. On se joint des pays du monde entier pour protéger les travailleurs et s'assurer qu'ils disposent de lieux de travail sûrs et respectueux. The labor movement in this country has made Canada the standard bearer on workers' rights. Unions work with us, they push us, and we work with them to understand the problems and find solutions. And then you get down to work and make it happen. Public policy matters. The examples that the federal government sets matters. Workers are safer, healthier, and better off for the work that you do every day. Thank you. Merci.
Thank you, Minister, for sharing your perspective with us and getting Safety and Health Week off to a great start. We share a goal to make Canada one of the safest countries in the world in which to work. It's my pleasure now to introduce our next guest, Amy Arsenault, Safety and Health Week Working Group Volunteer from the Canadian Society of Safety Engineering, also known as CSSE. CSSE was a founding organization of North American Occupational Health and Safety Week and has been an important partner in this week since it began. I'll hand it over to Amy now.
Thank you, Anne. Good morning, everybody. I feel privileged to be with you today from my home in Edmonton, Alberta on Treaty 6 lands to represent the members of the Canadian Society of Safety Engineering as we gather as a community from coast to coast to coast to kick off Safety and Health Week. I would like to begin with an acknowledgement of the Indigenous peoples of the lands upon which we gather, and I encourage you to become informed on the home on your native land. From east to west and north to south, let us acknowledge the ancestral and unceded territory of all the Innu, Métis, and First Nations peoples who have shared this land we all call home. As a health and safety professional and a dedicated volunteer of CSSE, from my perspective, there has never been a greater time and need for collaboration between occupational health and safety environmental HSE professionals and practitioners, employers, and the public. Safety and Health Week is an important call to action for partnership needed to promote and create safer workplaces and communities. It is an important opportunity to showcase and celebrate the success of these relationships and collaborations as it results in preventing injury and illness workplaces at home and in the community. The Canadian Society of Safety Engineering, CSSE, is Canada's largest association for occupational health and safety professionals, focused on advancing the profession and helping those who work in it to achieve their goals. Through the dedicated drive of our hundreds of volunteers, just like me, we provide leadership, connection, and educational opportunities for health, safety, environmental practitioners from coast to coast to coast across all industry sectors, from students to seasoned professionals. The health and safety profession is stronger because of our opportunities for its practitioners to connect, learn, and grow. This Canadian Society of Safety Engineering is proud to have been providing a forum for this to happen since 1949, and grateful to all of our members for their involvement and contributions. Safety and Health Week is just one such example. Safety and Health Week holds a great deal of significance for our members of CSSE as it roots deeply since we have been participating since 1986. Although the name has changed over the years from the Canadian Occupational Health and Safety Week to the North American Occupational Health and Safety Week, fondly known as NAOSH, and now we are known as the Safety and Health Week, the intention of staying the same, but bringing the awareness of the important work that we do, keeping all of our communities and workplaces safe. As health and safety practitioners and professionals, we understand the mechanisms of injury. We understand human ergonomics, interfacing and fitting to the worker, and we know how to identify occupational diseases and their causes. More importantly, we have access to workers and their working environments. We educate, we empower workers to be mindful of their tasks and interactions within both static and dynamic working environments. Through working hard to raise both individual awareness and employer responsibility, we continue to reduce the frequency and severity of injuries and illnesses in the workplace together. This week gives us an opportunity to share the successes we have found within that community. During Safety and Health Week, this is our time to renew our commitment to operate as a strong and vibrant, future-focused professional organization with a rich 75-year history in supporting our members as they work on the ground to create safe and healthy workplaces for every worker in Canada. In the coming year, you will start to see the CSSE begin to be known as the Health and Safety Professionals of Canada. As we continuously strive to move forward, while at the same time, the name may be different, but we still will be having the same place where our professionals can help and keep those workplaces and communities safe and gather together. Our new name says that with pride, Health and Safety Professionals of Canada. Whether you are a longstanding member, were a part of the association in the past, or hearing about our community today for the first time, I personally hope that you will join us as we better continue to serve the public. Association members and industry professionals have volunteered their time to put together an exciting lineup of professional development sessions during Safety and Health Week that are free to the public. You can attend live and register to view the post-event recordings on our website at csse.org. This is one example of how CSSE offers relevant, value-added occupational health and safety resources, training, networking, mentorship, and recognition opportunities so that we can empower professional development and career advancement of our members. To my colleagues as a peer, I want to use this stage today to pause and give you acknowledgement for all that you do. The work you do for workplaces is helping employers return home whole at the end of every shift. The education and networking you will receive over this week will benefit not only yourself, but those who you work with. You have my admiration for standing up and being advocates of health and safety, as it's often unrewarded. So please accept my applause and my acknowledgement for all that you do. To our partners, Threads for Life and the Canadian Centre for Occupational Health and Safety, thank you for your continued leadership and the invitation to join you today as I represent my fellow health and safety colleagues. Thank you so much.
Thank you, Amy, for representing our health and safety professionals and reminding us all of the important roles that they play in making our workplaces safer. Our next guest is Shirley Hickman, the Executive Director of Threads of Life, also a national partner in Health and Safety and Health Week. But more importantly, Threads is an organization that offers support to families who have experienced a workplace tragedy. Shirley?
I guess it helps to unmute. Thanks, Anne, and I welcome this opportunity. Amy, your words certainly resonated well with me, and I'm sure with our family members. You certainly all have that opportunity to be part of prevention. So together we can create safe workplaces and communities. The theme for our Health and Safety Week of 2023. So I ask you to consider if one person can make a difference. Then imagine what a community of safety-minded folks can do. Well, I believe one person can make a difference. You each have the opportunity to see something in a workplace that you know isn't right, or someone taking a shortcut because they think they found an easier or a quicker way. And I ask you, do you stop and speak up? If so, you likely saved an injury or even a death. Our Threads of Life family members know all too well that if someone had seen or spoke up, that they would not be living with the outcome of a worker at home with a life-altering injury or a vacant chair. We all know the annual stats, but for each of our family members, stats do not matter. It is one. One is too many. You may know that Threads of Life is still a young organization. We're entering our 20th year of providing support to family members. In 1996, when our 21-year-old son Tim went to work at his part-time job at a city arena and he didn't come home, our lives changed immediately. We entered a world of profound mourning and grief, but we also entered the world of unknown, of investigations, the legal process, inquests. Our family was so very fortunate. We were surrounded by caring friends and family in our local community, but neither could they understand the length of time for the legal process. We continue today to miss Tim. We miss his jokes. We miss what might have been in his or our future. Since that time, I have met many other family members with similar sad stories. Threads of Life is currently providing peer support to more than 3,350 family members, coast to coast. One thing we all have in common is a hole in our heart. Workers living with occupational illness or a life-altering injury and their families had a dream. They dreamed of a future that has now been forever changed. Many will go on and find a way to still be productive, but for others, the tolls are too huge. The death of a worker brings a lifetime of grief. The ripple effect is ongoing. Whether it's the fatality as a spouse, a child, a sibling, someone's niece or nephew, the empty chair will always be there. The longing for what might have been. Remember, each one of those workers has a name. They were loved, and they are still loved. Just think if you had been there and able to say, stop, let's do this a different way. Or, that doesn't look safe. Let's figure out why. Well, history is just that. But we all have a voice in the future to prevent further tragedies. While many of these workers and their family members find Threads of Life, many do not hear of this organization. You have Threads of Life now in your toolbox, and you can use that tool to help family members. The first few months is not likely the time to share Threads of Life information. Families are too dear, it's too raw in their state of emotions. But the journey goes on, so provide the information about the 6 months mark, or even a year, or even 5 years later. Provide the information repetitively. Families need to hear that you still care. Many will benefit by our peer support programs. For others, the newsletter or an opportunity to participate in Steps for Life, walking for families of workplace tragedy. Well, I hope all of you have either participated or have signed up for this year. Another word for community is village. There is a saying, it takes a village to raise a family. Threads of Life is very grateful to each of you for the support you have provided these past 20 years, and we know we can count on you going forward. It takes a village to change the culture of workplace safety awareness, but we all know that one person can make a difference. While some families choose to be trained as a volunteer family guide to provide that one-to-one listening ear, others have the challenge, have the courage to take their personal story for the sake of preventing one worker from being injured or dying at work. One family member that's making a difference is Virginia Campeau. Virginia was born and raised in Winnipeg and moved to Red Lake, Ontario in 2005. She is a registered social worker working in children's and youth mental health. Her goal is working towards her bachelor in social work. She has one daughter and two beautiful grandchildren. Virginia enjoys sharing much of her time as possible with her grandchildren and enjoys working out and being active. In 2015, Virginia's life was changed forever by a workplace tragedy. Virginia is now a volunteer with Threads of Life and a member of our Speakers Bureau. Please join me in welcoming Virginia, and we hear her message to encourage us all to speak out for safety. Thank you.
Thank you, Shirley, for the introduction and your profound words before then. It truly never gets any easier, no matter how much I speak about it. Like I said, it doesn't get any easier. It always takes me back to that period of time. So if I have to stop and just regroup, you know why. So just to give you a little bit of a glimpse of who Paul was, I loved so many things about him. He was just so humble, so kind, would literally take his shirt off the back and give it to somebody else in need. He enjoyed watching hockey. He enjoyed his NASCAR racing. He enjoyed driving his semi. He liked to be out in the open road. He loved life and he loved his family. But on January 6th of 2015, that all came to a sudden end. That day started like any other normal day. We woke up. He never would leave the house without giving me a kiss. We told each other that we loved each other. And then he walked out the door. But this time he wasn't returning. Paul was 45 at the time of his death. His occupation at the time was driving a sand truck to maintain the roads for winter safety. So like I said, this day was like any other day. It started like any other day. Every day I would text him, throughout the day to see how he was doing, to say hi, to see how his work was going. But on this day, he wasn't answering me. But it wasn't uncommon for him to be out in the bush without cell service. So I thought, okay, he's out of cell range. When he gets back into cell range, he'll text me, he'll let me know that he's good and everything will be fine. Well, as the morning went on to the afternoon and the afternoon went on to the night and the evening, I still wasn't hearing from him. But again, my thought process was, he's just, busy day. He's still out in the bush and, he'll contact me when he gets out. So I was going to wait till around 11. And if he wasn't home, I was going to start making some phone calls by 11 o'clock. Well, I ended up falling asleep on the couch and I woke up around 3 o'clock that morning and Paul was still not at home. I remember one lonely tear rolling down my cheek as I went to go grab the phone book. I got a hold of one of his employers, and they told me that they would check things out and get back to me. I then went and I grabbed my Bible and I went to go lay down in bed just to await any news. But I ended up falling asleep again, and I woke up around 7:30 that next morning to a knock at my door. Automatically, I thought it was Paul, so I raced to the door. And when I got there, there was two police officers, a male and a female. When I let them in, they proceeded to tell me that Paul had an accident and Paul passed away. Now from there, there's still a lot of things that are blurry, and there's a lot of things that will forever be embedded in my brain. But I remember screaming at the top of my lungs, no, 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 as I was backing away from the police officers. I just could not fathom what I was hearing. I mean, I kissed my husband the day before, and here they were telling me that he was no longer coming home. So I just could not comprehend what they were saying. I was just not processing. I was just screaming. From there, the female police officer helped me get dressed, and then she proceeded to take me to his mom's house, which seemed like the longest ride ever, where I had to tell her that her last born was not coming home. Like I said, a lot of things, blurry. I remember that, I had to give my cell phone to somebody because everybody was just trying to get a hold of me, and I just could not deal. I remember that night lying on his side of the bed and getting an overwhelming sense that he was cold. So I immediately got out of bed. I took a bunch of his clothes, held them in my arms so tight, thinking this is the only way that I can keep him warm because I wasn't physically there with him. I was, given sedatives. I was taken to the hospital by ambulance. My daughter had to stay with me while I showered because I was just so weak. I remember that I wanted all the pictures of us off the wall. I didn't want any of the flowers that were coming in. I wanted people just to take them out of the house. I just did not want any reminders of what was happening. I did not want to believe that Paul was gone. So soon afterwards, one of the police officers came back to my house, and where he proceeded to tell me that Paul somehow became stuck in an auger. And at that time, I'm like, okay, so what do you mean? Like, I couldn't hear him. I just didn't know what he was saying to me. Like, what do you mean he got stuck in an auger? But as I was looking around at the people around me, I can see the horror in their faces. But I was still was not getting it. All I wanted to do was just go and see Paul, but nobody was letting me go, understandably. I was told to prepare myself when it came time to view him. So when that day came, and this will always be embedded in my brain, his face was completely red from the harsh elements. His right hand and his right hand and left leg were completely mangled and wrapped in plastic. His left leg was gone below the knee, but that was also wrapped in plastic and placed beside him. The only hand that wasn't affected was his left hand. And to this day, I think that's a blessing because I was able to get his wedding ring back. There was a sign that an autopsy was done on him, and I remember I wasn't expecting that. So that was another blow to my heart, because knowing that he had to go through this all alone just broke me. I remember sitting by his casket, and his left hand was so cold. And I remember trying to rub it to get it warm, but of course, nothing was helping. I sat beside him and I sang the last verse to the gospel hymn, "Abide by Me," because again, that was the only way I knew that I could give him some comfort. At his going away service, that part's a little bit of a blur to this day, but I remember I wrote him a letter, and I went up there and I read that letter to him. And even though there was so many people in that church, it felt that it was just me and him, just me and him. So after I read him the letter, I kissed his casket for the last time. I watched his pallbearers take him to the hearse, and I watched that hearse drive away from my sight. And then came the daunting task of going home to pack away all of his clothes. So we got married in August of 2014. And here I was saying goodbye to him at that same church that we got married 5 months later. You know, we didn't even have a chance to celebrate our first year anniversary, and I will always feel robbed of that. As time went on, I learned more about the accident. So they found Paul around 3:15 that morning. He was completely frozen solid. His left leg and arms were entangled in the auger. It was a lengthy process to remove him because they had to do a partial amputation on his left leg, and they had to dismantle the truck to dislodge him. In the autopsy report, it was stating that the truck was still running and the auger was still turning when they found him. His pants were completely ripped away from the waist down, threaded in the auger. Nobody knew how much blood he lost because, like I said, the auger was still turning, so therefore the blood was mixed in with the sand. No one knows exactly what happened. He was working alone. The last time he was seen alive was at 1:25 the afternoon of January 6th. But I was reassured that he didn't suffer. So what happened was the auger, which was located inside the hopper of the sand truck, would jam up during extremely cold weather. On that day, the temperatures were between -27 and -30 degrees. And with the wind chill, it dipped down to -36. So as a makeshift solution, they were using a shovel to get the auger unjammed so the sand will start filtering through. When they found Paul, it was noted in the autopsy report that the shovel was found nearby his body. I came to later discover as well that a part was placed on order for that truck, and I have to wonder if they waited for that order to come in, if the outcome would be a different story today. So, you know, a workplace accident took my husband's life so sudden and senseless. And, you know, because they didn't use the proper safety measures, because of that, Paul is dead. I am here left asking why constantly. You know, all our hopes and dreams are gone. He will never see his grandchildren grow up. so many things that will never be. So, Threads of Life's mission statement, it speaks directly to why I became a volunteer speaker and why I speak today. We all truly do need to come together and make sure workers come home safe to their families and eliminate workplace tragedies. As much as Threads of Life is a great organization, it's an important organization, and I'm proud to be a part of it. Eventually, I'm hoping that I don't have to be, because we won't need Threads of Life anymore, as I hope all workers will be protected and remain safe from fatalities or injuries or illnesses and come home to their families every day. I share my story not only to honor Paul's memory, but I also share it to reach out to families in hopes that they don't go through the same grief that I went through, the grief that I'm going through now, and the grief that I will always go through. Workplace safety is not negotiable. Know the hazards related to your jobs. If you feel something is unsafe, please say no, please walk away. Think before you act, because death is final and there's no coming back for that. And I'm here to tell you that I am still struggling with this tragedy. I'm still grieving over it. I'm still asking myself why. So just please know the hazards to your job. Please walk away. You have the right to say no, because like I said, death is final and there's no coming back from that. Thank you.
Thank you, Shirley, and also Virginia, for sharing your story with us. I know I speak for all of us when I say how very, very sorry we are for your loss. And it's a painful but very important reminder of the far-reaching impact that one catastrophic injury or illness can have on loved ones, family, friends, and community. And I know you share our hope that one day we can prevent these tragedies and that there will be no families in need of support, as you said at the end of your presentation. So thank you very much for being part of this. So that takes us to the final or the finale, I should say, and one of the highlights of the program. We get to find out who takes the prize in this year's National Youth Video Contest. This year, we've had 9 videos submitted from the provinces and territories. They were insightful and imaginative, and the talent of these youth, just as it has forever, did not disappoint. So we're going to start by showing you the 3rd place winning video entitled Safety at Work.
Bienvenue au cours de sécurité du Nouveau-Brunswick. Je vais vous présenter une explication sur Merci d'avoir écouté ma présentation. Je vous souhaite bonne chance dans notre entreprise.
Écoutez les consignes données par vos mentors. Demandez de l'aide lorsque tu en as besoin. Utilisez les ressources données pour être en sécurité. La sagesse d'évaluer consciemment en utilisant nos ressources intelligemment au travail tout en restant à l'écoute. La sécurité est importante.
So our $1,000 third prize goes to Liliane Gagné of Mathieu Martin High School in Dieppe, New Brunswick. Liliane's school will receive a matching prize. Félicitations, Liliane. Next, we'll take a look at our second place winning video entitled Child's Play.
Hey Steven,
Oui.
prends le chariot élévateur. Ces deux caisses-là, je voudrais que tu ailles me porter ça dans l'entrepôt d'eau.
Chariot, élévateur, j'ai pas eu mes formations pour ça.
C'est pas compliqué, là, tu vois. C'est comme un jeu vidéo, là. T'aimes ça, jouer aux jeux vidéo? Ben simple de même.
OK, je vais le faire.
Merci.
Salut Steven.
Ouais.
Ça a l'air à chercher comment partir ça.
Ben, j'ai même pas eu ma formation, mais François m'a demandé d'aller porter les 2 boîtes dans l'entrepôt.
Tu sais, t'as le droit de refuser, mon ami.
Ouais, je pense que t'as bien raison.
This video was produced by Cédric Loubier of Quebec. Congratulations, Cédric, on taking home the $1,500 second prize. Félicitations à Cédric pour avoir remporté le deuxième prix de $1,500. Finally, let's take a look at the first place winning video entitled Safety is No Accident.
Okay, sweet. I'm ready to start my project.
Hey,
Hi.
have you considered the safety precautions you were going to take before?
Nobody cares about that nonsense anyways.
Hey, remember me?
Yeah, what do you want now?
I want to remind you about exercising proper workplace safety.
Why?
Because without it, you can seriously enter harm's way.
Okay, I hate to disappoint, but I don't know much about workplace safety.
That's okay. Put these on. I'll show you.
Whoa! Whoa, what's this supposed to be?
This is what would have happened if I didn't stop you from continuing that project.
I can't breathe. All right, why are you showing me this? You're just trying to freak me. Whoa! Are you trying to freak me out?
No, but the consequences of not exercising proper workplace safety should.
Okay, I get it. Can I start my project? I'll do all the safety, the workplace stuff.
Well, the first thing to always remember is to wear the proper equipment needed for the job.
Whoa! Come on, I look ridiculous.
Well, I never said you'll be winning any fashion contests, but I can guarantee that you'll be a whole lot safer.
Okay, I get it. Can I please get started now?
Wait, there's one thing you need to remember.
Is it that I need to always be aware of my surroundings and know the safety regulations regarding the heavy equipment?
Yeah, that pretty much covers it. Now you can go ahead and get started.
pleased to present our $2,000 first place prize to Lucas Feely and Jericho Manaloto of Holy Rosary High School in Lloydminster, Saskatchewan. Your school will also receive a matching prize. So congratulations, Lucas and Jericho. This is so well deserved, and all 3 videos were really well done. So congratulations to everybody. So before we close, I want to acknowledge our panel of very busy judges for their time in evaluating the videos. So thank you to Andrew Shaver, past National Executive Vice President of Public Service Alliance of Canada, Chelsea Wong, a Youth Advisory Group volunteer at the Youth Mental Health Canada, Kelly Moraes Sugiyama, National Executive at Aboriginal Peoples Television Network, and of course, Shirley Hickman, Executive Director of Threads of Life. And thank you to all of you for spending some of your day with us. Safety and Health Week is only 1 week, but our commitment to creating workplaces and environments that are physically and psychologically safe must remain strong every day, all year long. We hope to see you at the remainder of our Safety and Health Week events. You can register via the link in the chat. So on behalf of our guests, our national partners at CSSE and Threads of Life, and our staff, I wish you a fruitful Safety and Health Week. So long.